morning and welcome to yet another episode of the Government Information Center, coming to you from the Ministry of Information and Communication Technology, MICT-Kavango East Regional Office. So today we discuss the 2026 Indoor Residual Spraying launch. I am your host, Joseph Kamata. Before we start, let me just give you a brief introduction about the Indoor Residual Spraying launch. Indoor Residual Spraying, IRS, is conducted annually from September to December as a primary vector control intervention aimed at reducing malaria transmission, mobility, and mortality caused by the female Anopheles mosquito. IRS remains one of the most effective malaria prevention strategies and plays a critical role in Namibia's efforts towards malaria elimination. Despite continued implementation of IRS, the intervention has faced several challenges over the past 4 years, including logistical constraints and high refusal rates by community members. Consequently, the country has consistently failed to achieve the World Health Organization (WHO) recommended IRS coverage target of 85%. To achieve the national target of at least 85% IRS coverage during the 2026 spraying campaign, there is a need for intensified community mobilization, awareness creation, and behavior change interventions. The IRS launch campaign will serve as a national call to action aimed at strengthening community participation in malaria prevention and control interventions, increasing acceptance of IRS, and encouraging proactive malaria prevention behaviors. The 2026 IRS launch campaign will be commemorated under the World Health Organization's theme, Driven to End Malaria Now, We Can, Now We Must. These themes call for urgent action, collective responsibility, and strengthened commitment towards malaria elimination. The national theme, Together for 85% coverage, Together for Zero Malaria, underscores the importance of collective action in achieving the national IRS coverage target of 85%, which is essential for reducing malaria transmission. As Namibia advances towards its target of malaria elimination by 2027, this year's observance serves as a critical call for sustained political commitment, increased investment, and strengthened multi-sectoral collaboration. So that was just an introduction of today's discussion. So with that, today in studio, I am joined by two guests, two officials from the Ministry of Health and Social Services, the Kavango East Regional Office. So with me in studio today is Mr. Sakeus Nairenge, the Acting Regional Director under the Directorate of Health and Social Services, Kavango East Region. Mr. Nairenge, good morning and welcome to the show.
Good morning and good morning to all the viewers. We are very happy to be here to discuss about indoor residual spraying.
Thank you so much. Mr. Nairenge is not alone with me in studio today. We also have Ms. Martina Shitarara, the Chief Environmental Health Practitioner from the Directorate of Health and Social Services, Kavango East Region as well. Ms. Shitarara, good morning and welcome to the show.
Good morning, sir, and to all the viewers. Thank you very much.
We are very happy to have you today. So maybe just to start off, Ms. Shitarara, can you perhaps just tell us more about the background of the indoor residual spraying, which is IRS?
Okay. Actually, IRS, which is the Indoor Residual Spraying Program, started in 1965 within our country, Namibia. It is considered as the most effective method of malaria prevention and controlling the spread of malaria within our communities. This program involves the application or the spraying of insecticides into our houses. This is the internal walls of the houses, as well as the ceilings and any other furniture that can harbor mosquitoes, for example, the tables. And they are sprayed to target mosquitoes at their adult stage. You know, mosquitoes start from the water stage and to the land stage. So this spraying program targets the adult mosquitoes that can be able to take the parasite from person A to person B. So this spraying or the insecticides applied on the walls, they significantly reduce mosquito population, which ensures that the transmission is cut, it's limited. So when the insecticide is sprayed, mosquitoes, after they feed, they come and rest on these walls. So once they rest on those walls, then the insecticide gets into their nervous systems, and then their lifespan is cut short. It can allow to or lead to the cut of the transmission of this malaria. So it's a very effective program, and it has been implemented for years. And for the past 4 years, we have experienced a lot of logistical IRS challenges that have led to not reaching the target, like you stated, the WHO target of 85% coverage. These logistical challenges, such as inadequate transport, late arrival of procured insecticides, and also the lack of acceptance within our communities has led to us not to achieve this 85% coverage. Thank you.
All right. You've mentioned quite a few challenges that we have faced with regards to the IRS campaign. Perhaps, Mr. Nairenge, can you perhaps give us just the current malaria situation in Namibia and which regions are mostly affected?
Yeah, thank you very much. So this year we were hit hardest compared to last year, 2025. So our data is showing that there have been an increase of cases by 32% compared to last year. So nationally we have reported close to 122,000 cases. That's in the whole country. But if we bring it down, in Kavango East region, we have reported, that is from January to early August, we have reported 37,000 cases and 22 deaths that we have lost. But if you look at the malaria map in our country, the most affected regions are the northern regions, especially regions that are bordering Angola. That is Zambezi, Kavango East, Kavango West, Angwena, and Omsati. Those are the most hit regions. But also centrally, now and then, Ochozonjupa will also in Tomaheke will report cases, but they are not the most affected regions. So this highlights that these interventions are really needed because we are losing lives, and you know, behind these statistics or behind this data, it's a human face. Somebody's brother, somebody's sister, or a spouse of somebody that was either sick or that was lost. So that's why we really, this year, we want to start from mobilizing, sensitizing the community so that we can have a good coverage.
Yeah.
Yes.
Yeah. Maybe just to continue still with you, Mr. Nairenge, you've mentioned quite a higher number of statistics. You've also mentioned quite regions, Kavango West, Kavango East, as well as Zambezi. Perhaps what are some of the key challenges that are contributing to the continued malaria outbreak in Namibia?
Yes, you know, Namibia is a developing country, so the resources, we are operating under limited resources. Those are the biggest constraint. To do this operation or to do this campaign requires quite a huge number of resources, especially when it comes to the vehicles that you need to go to all these villages. The insecticide, you need it in you know, high volume, so you need a lot of it. That's running into millions. So the biggest challenge is resource constraints. And then, of course, the community. You know, it is a free country.
Yeah.
Even if the team come to your house, we still need you to consent. Yeah, it's not like it's mandatory that every structure needs to be sprayed. So this method, though it has helped other countries to eliminate malaria, it still requires community acceptance. And the way there's no community acceptance, it still can be a challenge and an obstacle. So there have been some straightforward refusal. The people say, no, I don't want my house to be sprayed. But there are also indirect refusal, what we call locked structures. You know, if people see that, because these people are visible in the community, they can see they've started with my neighbor. So if they've started with my neighbor, I just lock my house and go to the shabin and sit there.
Yeah.
And they wait for them to pass. So sometimes you find out that some of the households are locked and there's nothing you can do. You need to go over. And of course, cross-border movement of the population is a key challenge that we have. and some interventions that's being done in another country may not be done in the other country, and so some of those challenges are there. And our border is porous; people can cross anywhere. Where there's a river, you just you use a canoe, you cross.
Yeah.
If there's no river, there's a fence. The fence has been cut, you just cross over. So those are all challenges when it comes to the control of this disease. And the environmental factors, of course, like my colleague have said, this disease is spread by the mosquitoes, and the mosquito like good environment, humid, with a lot of water bodies and high temperatures. That's the environment they like to breed and then reproduce at a faster rate. So all these factors now contribute to high malaria cases and and challenges also to the control of this disease. Yes.
All right. Perhaps bringing it back to IRS, coming back to you, Ms. Shitarara, why is indoor residual spraying, IRS, still a key priority intervention to prevent malaria?
Okay, thank you. The indoor residual spraying program is very effective. See, mostly when the mosquitoes feed, they rest. They need somewhere to rest. They basically feed just for their eggs, so they need somewhere to rest. And when they are resting, they usually rest indoors. So this program is still very key because it's targeting the mosquitoes when they are resting. So this program, it aims at reducing the population of this mosquito. You see, we would say the mosquito is our enemy, but in fact, our biggest enemy is the parasite that you find within the body. But that parasite needs someone to move it, which is now this mosquito. So this is the most effective way of controlling this vector. Even if we control it at the water stage, but then it becomes more problematic to the community when it's busy flying out there. So it's still a key intervention because it targets reducing the population of these mosquitoes within the community. That is why it's very effective. It's still considered the most effective prevention method nationally and also in SADC, other countries as well. But now its success highly depends on the community acceptance. Not like my director has said, without the community accepting this program, we will not be able to get this 85% that has been recommended by WHO. And we are experiencing a lot of indirect refusals, like my director has stated. You would find people saying, no, that house belongs to someone and they are now in the city looking for work. But the moment you leave, you'll see this person going into that structure that belongs to someone in the city. So it's still very effective because it has successfully shown that it reduces the vector population, which is this mosquito that's able to transmit the parasite from me to you, from you to him, just from person to person. So that's why it's very, very effective. But then we need our community to accept, to allow the ministry to be able to implement this intervention in the house so we can get the maximum protection to our communities and ensure that we are saving lives.
Yeah. So in other words, you are saying that the less mosquitoes, the less transmissions.
Yes.
Okay.
Less mosquitoes, less transmission.
Definitely. Well, if you've just tuned in, you are tuned on to the Government Information Center coming to you from the Ministry of Information and Communication Technology, MICT, from the Kavango East Regional Office. So just to continue again with Ms. Shitarara, you have mentioned a lot of community refusals, and you're also emphasizing that the community should agree, and the only way for the campaign to be successful is when the community works together with the ministry. So perhaps how does the IRS team emphasize the role of communities in malaria elimination?
Okay. The theme is underscoring that the elimination of malaria does not solely only depend on the government. or per se to say it's just on Ministry of Health. The theme is calling for a strong collaboration between government institutions as well as our community. The communities where we employ to implement this intervention. So it emphasizes that malaria elimination and active community participation or involvement helps to achieve this. The community's involvement is a key. It's the main key to ensuring that malaria is eliminated. If one person is able to be able to say, this year I decide my house, all my structures will be sprayed, because the ministry has been saying, no, it's very effective, it's very effective. Let me play my part as a community member. Let me be that one change that we need. Because zero malaria starts with each one of us. In order for us to achieve this zero malaria local transmission, it starts with me and you. So in the community supporting the government, the political will is there. We are seeing all our politicians are coming in. They are supporting us. Our minister is fully 100% on board with the implementation of the IRS program within our communities. So I say the communities are refusing, but with the communities coming on board and supporting the government ministries, Ministry of Health, then we are able to achieve this target. But alone, we cannot. We can try to do so much, but if the end users are not accepting it, the ministry will still fail. So the theme is strongly calling for close collaboration, where we put our hands together and join forces to fight against malaria transmission within our communities.
Yeah. Moving on to Mr. Nairenge, one of the challenges is with regards to malaria is late health seeking behavior from the community members. Perhaps just in a nutshell, why is early diagnosis and treatment critical in controlling malaria, and what is being done to ensure access to healthcare in remote areas as the cases of malaria also continue to grow in remote areas?
Yeah. Thank you very much for that question. So when prevention fails, then people get sick, and that's where we are now. So once you get the disease, what happens then? So all hope is not lost. Malaria signs and symptoms are, people, you develop fever, vomiting, headache, and then fatigue, tiredness. So once these signs are there, it's very, very important that people should seek care. With this technology now, we have rapid test kits that can easily diagnose malaria, even in the household level, or remote clinic. We'll just prick you on your finger, take the 2 drops of blood, and then within 20-30 minutes, we already know if you have malaria or not. So the earlier, the better, because it prevents severe disease and death. And it also has a component of limiting or controlling transmission. The mosquito that is troubling us, the female one, they are also not born with the parasite. They are just living their lives there in the wild. But they also get parasite from us human beings. So if a person is having malaria and is not being treated, all those days, that means the parasite is in the blood of this person. Once the mosquito bites this person, they pick up this parasite and start transmitting it to others. But if you come early and you are treated, then the medicine will kill the parasite within your bloodstream. So even if the mosquito come and pick up a blood meal from you, they will not be able to transmit again. So that's one of the advantages why, not only to prevent death or severe disease, but also to prevent transmission. So the ministry has quite a number of health facilities. I mean, in our region, we have about 33 health facilities in our region. And we also have mobile clinics in each of our districts. We have vehicles and nurses that goes to the remote villages and remote areas to treat and offer health services. On top of that, we also have community health workers. Both in government, we have community health workers, and there are also organizations like DAPP that have community health workers for malaria. And these are the people that goes into household, identify cases, test the cases. If they test positive, they treat cases. So we should not, I know some people think malaria is common cold. It's quite different.
Yeah.
Malaria is dangerous. If it's not treated, it will develop into a severe form of the disease, where people get confused, their mental state becomes unstable, they start seeing things, and people think it's witchcraft. It's not witchcraft, it's just like they say in the late term that when the malaria goes to the brain, and the brain is affected, you start hearing things which other people are not hearing, seeing things, and that is a severe form. It affects you. Even if you recover, sometimes that damage is there. There's nothing we can do about it. So we encourage people to, once you see these signs and symptoms, please rush to the nearest health facility, get tested, get treated, and you can, it's completely curable. We can cure it in a few days, 3-4 days, you'll be fine. Yes.
But we are still emphasizing on prevention is better than cure.
Yes, prevention is always better than cure.
Yeah.
It's only that when we see these numbers, we know that prevention somewhere, somehow affects us.
Definitely.
Yes, but health promotion and health prevention still remains the golden rule, or the best option to take. As individuals in these communities.
Yeah, thank you so much. Ms. Shitarara, you've mentioned collaboration quite a lot. So perhaps if there are people out there that want to get involved in supporting the fight against malaria in Namibia, how can they do so?
Thank you. That's a very good question. How can we ensure collaboration? Okay. Every single person has a role to play. To start off with our community, where we are trying to implement this intervention, the community has the biggest role to play. This is in them adopting or accepting the interventions that the ministry is willing to implement. So we want the communities to accept and support the indoor residual spraying. How do they do that? By allowing the spray teams or the spray operators to access their houses where they are sleeping, so they can be able to apply these chemicals on the walls. That is the role of the community. Then we have our community and traditional leaders. We want them to be our champions for malaria elimination, for malaria programs. We want our community leaders and traditional leaders to be at the forefront of championing for this malaria intervention that can help reduce the transmission. Then we are also calling on our partners. Our partners also have a role to play. Our partners can assist us in terms of resource mobilization. We are mostly struggling with we've said we are receiving our insecticides late. We are also having a challenge of having adequate pumps. Our partners can come in and support us in that form. They can also support us when we are busy conducting our mobilization activities in these different communities, especially those communities that are having high malaria cases. Our business community, they can come on board, they can assist us, they can assist the ministry. Can also come to them assisting in us being able to, if we are calling our community leaders or our traditional leaders to hold these meetings, you wouldn't want to keep someone for 2-3 hours on an empty stomach. So our business communities can come along and give us juice, some water, a few refreshments for us to be able to educate our leaders, because these are our gatekeepers to the communities. And these are the people that our community members listen to, that they respect. And then also government itself is fully committed to implementing malaria elimination and ensuring that our health systems are strengthened. So that's how they can come in and play. So together we can achieve a malaria-free Namibia. How do we do this? We need to educate ourselves. this information sharing that's happening now, it's part of educating our communities. So we need to know what is malaria, how do we protect ourselves against this deadly disease. It's very curable, it's preventable, but it has taken a lot of lives. We are able to save lives simply by us adopting these preventive measures. Allow the spray operators to enter your structures to spray these houses. Clear the standing waters. You know, when it rains, there will be small pools of water left.
Yes.
But when the sunlight comes on, creates a favorable environment for this Anopheles female mosquito. And it's female, it's a lady. Now it looks like we are the ones bringing problems. But it's not really us.
Yeah.
We just want, the mosquito just wants blood for their eggs.
the
But in that,
environment.
in that process, it ends up transmitting the parasite to the next person. So we can allow IRS teams to spray our houses. We can also use the long-lasting insecticidal nets. You would see the government will try to get some nets here and there, giving to the communities. And then you will now come and see this mosquito net is also now trying to eradicate hunger. It's catching fish. It's no longer being used for the intended purpose. So it's just a matter of us getting educated. How do we use the available interventions to ensure that malaria is prevented? And also eliminating our breeding water bodies or our breeding sites. This is clearing our surroundings. Everybody in the community can do that. Keep your environment clean. Do not leave empty containers or empty tins where water can be allowed to stand for some few days and then the mosquito starts breeding in there. Just maintaining a clean environment. We remove all the weeds. Even during our cultivation season, we should not cultivate up until into the doorstep of our structures where we are sleeping. We know hunger is there. But also if malaria is killing us, then life will be ended. So the effort of malaria elimination, everybody has a key role to play, starting from me as a community member up to the highest level, even our political leaders, our business community. So everybody has a role to play in eliminating malaria in Namibia.
Yeah.
Thank you.
So yeah, as we approach the conclusion, I would like us now to discuss the official launch coming to you now, Mr. Nairenge. Can you please walk us through details of the launch of this IRS campaign in terms of the dates, the venue, the program, and also could you perhaps briefly outline the planned activities of the launch that is set to take place in Nghidinwa in the Kavango East region?
Yes, thank you. This year Kavango East is very lucky because the national launch for this campaign will happen in our region. And as you have rightly said, it's happening on the 2nd of September 2026. That's next week, Wednesday. We have invited quite a large number of people. Out of the 14 regions in our country, 10 regions report malaria cases, and all of them we have invited them, from their governor, chairperson of the regional council, the CRO, the regional directors, and key senior staffs in Ministry of Health. We've invited them. We have also invited quite our development partners, World Health Organization, Development of Aid People to People, Clinton Health Access Initiative. They help us with malaria elimination, SADC Elimination 8. They are all coming. Then on top of that, of course, the keynote speaker for this event will be our Honorable Minister of Health and Social Services, Dr. Esperanza Lovindao, will give the keynote speaker. She will be here. She is very happy to come because you know that area where we are going, that's one of the areas, that's the hotspot of malaria. So the program the people on the ground have started preparing already. Community health workers have been informed. The district is ready. The management is ready there. So we are inviting, including MICT, before I forget.
Yes,
yeah,
please.
MICT is very key. We are also invited.
Yeah.
We are inviting all the public to come. The refreshment will be there, it's being prepared, so we can all come listen to this message. The bigger the group, the better, because this is a big event. It's the national launch. Everyone in Namibia is heading to Divundu on 2nd of September 2026. So it's good because it will create awareness. It's good also because this public health intervention, we need to promote it, we need to accept it, and we need to go and tell our friends, our neighbors, and our colleagues. So that's how the program is lined up. Some of the activities leading up to the program will just be majorly community engagement, village visitation, and then promotion of this program. Yes.
Well, you've mentioned quite a few activities. I'm asking for a friend. Will there be T-shirts, perhaps?
Yeah. So our colleagues from Windhoek are coming. I don't know what is installed there for them.
Yeah, definitely.
I can't really promise now whether there will be T-shirt, but let's hope there will be.
I'm just joking.
Yeah.
In conclusion, Ms. Chitarara, what message would you like maybe to leave with our viewers with regards to malaria prevention and the importance of supporting this campaign?
Okay. To the viewers, malaria is a very deadly disease. It can kill even within hours, especially if early treatment has not been sought. So it's deadly, but it's 100% curable and preventable. So my message to the community and the viewers is, please support the intervention that the Ministry of Health is bringing into our communities, into our households. Allow for spray operators to spray your sleeping structures or your sleeping rooms. And also, do not wait and say, my head is just paining now. I'll just sleep maybe for an hour or two. Or perhaps, no, I'll just go tomorrow. You have fever today. No, I'll go to the clinic tomorrow. When the malaria signs and symptoms start showing, please do not delay. Early health treatment saves lives. If you delay with getting malaria treatment, we will lose you. Malaria is preventable. It's curable. We are not supposed to lose anybody because of malaria. So support the intervention that the ministry is bringing. And we are looking forward to seeing everybody at the launch so we can come and share this knowledge with everyone else. Thank you.
All right. Director, maybe just in short, you've mentioned that we have invited a lot of people. We have invited the governors from 10 different regions. So perhaps what is your final message to the people of Divundu and the surrounding areas regarding the launch on the 2nd of September?
Yes, so people for Divundu, we are coming. Please come to the venue. They know it's in that plot, the open field next to opposite the police station or Standard Bank, just opposite Standard Bank. So you are all invited. And this is a government activity. Some people look at a government activity like it's so external. But if you look at it closer, actually we are using your tax money to do this activity. So it's actually your money. So let us not go into waste. Let us support each other. Let us come and listen to the message the minister has for us and all other dignitaries that will speak. And then we celebrate together. From there, then the campaign starts. The launch and then the campaign starts. Yes.
Thank you so much. Before we close the episode, please be informed that at around 2:30, stay tuned on our Facebook page as we'll still be having another Government Information Center's information sharing session. This time we'll be hosting officials from the Lifeline and Childline Namibia in partnership with UNICEF Namibia. They'll also come to share about the Right Start project. This is a project that is aiming to educate parents on the early developmental change as well as positive parenting in the Kavango East region. So please do stay tuned around 2:30 for that episode. And then with that, I am your host, Joseph Kamata. So from me, the guest in the studio, as well as the entire crew from MICT-Kavango East region, it's bye-bye. Until next time.